Hello everyone, welcome back to Nursing Simplified. In today's lecture, we are going to discuss the important topic concept of preventive pediatrics in pediatric nursing. Preventive pediatrics focuses on the prevention of diseases, promotion of child health, early identification of health problems, immunization, nutritional guidance, and healthy growth and development of the children. As we all know, prevention is better than cure. The health of the children mainly depends upon preventive care. Majority of the child health problems are preventable. Definition: the preventive pediatrics has been defined as the prevention of diseases and promotion of physical, mental, and social well being of the children with the aim of attaining positive health. It means it mainly deals with preventing the diseases to the children, preventing the incidence of diseases, occurrence of diseases in children, and promoting their health in all the domains like physical, mental, and social well being. So, to attain the positive health in children, these are the purpose and objectives of preventive pediatrics. The main objective and the main purpose of preventive pediatrics is nothing but so just remember it blindly prevention of diseases and promotion of health. This is the very important objective of preventive pediatrics. And apart from that, the other objectives include prevention of disabilities. How can we prevent the diseases or disabilities? So, by giving proper nutrition, by giving immunization on time, through maintaining sanitation, by assessment of the children in every stage of growth and development, by assessing the children whether they are reaching the milestones in appropriate age. This helps in prevention of diseases, disabilities, and promote the healthy growth and development in the children. And of course, it reduces the child mortality and morbidity. Mortality is death, and morbidity is sickness. So, by giving proper nutrition, proper immunization, we can prevent the infections from antenatal, intranatal, and postnatal period, which reduces the mortality and morbidity in children. And early detection of health problems also helps in preventing the diseases, helps in preventing the complications, helps in preventing the disabilities. So nowadays there are a lot of advancements and technologies have been developed in the field of medicine and also in the field of pediatric nursing, so which helps in diagnosing the health problems, even the diagnosing the health problems even during gestational period, even during pregnancy, like the genetic problems can also be identified and detected mostly through genetic screening. So early detection of health problems prevents the disabilities and complications and mortalities in children. So educate the parents regarding the children's diseases. What are the diseases that frequently occur to the children, how to prevent those diseases, and how to promote growth, and how to prevent infection. Educate the parents regarding this. And importance of preventive pediatrics is mainly, so the preventive pediatrics deals with improving the quality of the life of the children by maintaining their health, by promoting their health, by preventing the disease. Either it can be the communicable diseases or nutritional disease. The examples for communicable diseases are TB, pneumonia, measles, rubella, diarrhea. So all these are communicable diseases. This can be prevented by giving immunization and maintaining proper sanitation. And nutritional diseases examples can be protein energy malnutrition, obesity, diabetes mellitus, etc. So these can be prevented by providing proper nutrition to the children. So the preventive pediatrics mainly deals with prevention of diseases. Either it can be communicable, non-communicable, or nutritional diseases, and it mainly works for promoting the health of the children, and of course promoting the physical and mental development of the children. So when a child is healthy, when they are free from infections and disease, that reduces the healthcare costs in the family and supporting the family and community health. So this is the importance of preventive pediatrics. Types of preventive pediatrics. Mainly, there are three types of preventive pediatrics. There are antenatal preventive pediatrics, postnatal preventive pediatrics, and social pediatrics. Antenatal preventive pediatrics means giving care to the pregnant mothers. That means giving care to the fetuses, giving care to the pregnant women, so that can reduce the illnesses, that can reduce the complications, that can reduce the congenital diseases, nutritional diseases, and infections to the children, to the child. So, preparing the mother for the delivery and caring the pregnant mothers by providing proper nutrition, immunization to the pregnant women can help in the reduction in the occurrence or the incidence of the diseases to the children, reduction in the child mortality and morbidity. Postnatal preventive pediatrics. So, postnatal after the birth of the child, so periodic medical checkup for infants is really very needed to assess the growth and development, to assess the optimal achievement of the milestones appropriate to the age. So, periodic checkup for the infants. Prevention of accidents in children, very particularly in case of infants and toddlers. Prevention of accidents like falls, burns, drowning, and also giving emotional security for children is all about postnatal preventive pediatrics. Social pediatrics. Social pediatrics, it is the application of the principles of the social medicine to pediatrics to understand the problems of the children in order to prevent and to treat the diseases. So, healthy and happy parents will have the children. Parents help the children grow healthily, happily, and also they are helpful in preventing the disease and promoting a healthy environment for the children. So, a clean, healthful house and living environment, everything can be provided by healthy and happy parents. That is really very important, and improving the educational opportunities for children. So, all this comes under social pediatrics. So this is the antenatal preventive pediatric. So as I have told you, the regular antenatal checkups, that means every month, every whatever it is according to the physician prescription, according to the physician's orders. So the pregnant woman has to go to antenatal checkups and take proper nutrition supplements and prevention of the maternal infections. So by giving immunization to the pregnant woman or mother, example tetanus, generally the vaccination cannot be done given to the pregnant woman. So what else we can give is tetanus tox or TT can be given, and health education to the women. So early detection of the fetal abnormalities through various diagnostic tests can also help in prevention of complications and disabilities in children. Postnatal preventive pediatrics, so that is after the birth of the child, newborn care and monitoring the children. So monitoring that child, so how they are, the weight, the stature, the circumferences, the fontanelles, the how they are performing, everything, the monitoring and assessing the children and taking care of the children, giving care to the children if anything is wrong, an immunization schedule, following the immunization schedule and giving all the vaccinations on time, promoting breastfeeding to the children, educating the mother regarding the breastfeeding benefits and positions of breastfeeding, and monitoring the growth and development of children time to time by uh, assessing or by checking the children in infant stage very particularly, and guiding the parents regarding nutrition and hygienic practices, so to care for the children, and early detection of illnesses in case of any illnesses or infections present to the infants. social pediatrics, so contributing or participating in all the child health programs and policies helps to develop the awareness and knowledge regarding raising a children, how to maintain their health, how to promote their health, and how and what time and which time so they need to give the immunization or vaccination to the children, promoting a healthy environment and following sanitation and providing educational opportunities. And all the school health services nowadays in the schools, they are giving a lot of, they're providing a lot of services like dental screening, so medical checkups, for medical checkups very particular regarding the eye checkups and all. So participating in the school health services and preventing the malnutrition by providing proper nutritional food, and protecting the child, so giving emotional security to them. And so all these are the uh, preventive pediatrics, where the child can be monitored, where their growth can be promoted. And health education for the parents is really very important. We give the health education and awareness to the parents regarding immunization, what are the vaccines to be given and at what age they are given. And we educate the parents regarding health, breastfeeding, the benefits of breastfeeding and the techniques of breastfeeding, the positions of breastfeeding, so and also providing education to the parents regarding the importance of balanced diet, balanced nutrition, and what are the things that improve the nutritional status of the child for their child growth and all. And also recognizing any signs and symptoms or danger signs of illnesses early by bringing them or taking regular medical checkups for the children. And also safe, promoting or providing safe home environment and injury prevention to the children. So very particularly children are very reactive, so they run, walk, um, they are enthusiastic and curious to know each and everything. So most only the children will be injured. So injury prevention is really very important. And so yeah, this is the summary of preventive pediatrics. Summary: preventive pediatrics promotes the child health. The main thing the preventive pediatrics does is preventing the diseases and promoting the health of the children. So these are the two main things the preventive pediatrics does. So and of course it continues, so from or before the birth and throughout the childhood. So and it includes antenatal, postnatal, intranatal, and social care. Parent education is really very important. We need to educate the parents regarding these conditions, how the children are to be vaccinated, how the sanitation is to be provided, how the healthy full environment has to be provided, what new type of nutritious diet has to be given to the children to prevent the diseases, promote their growth and development. I hope this lecture helped you understand the topic clearly. If you found this video useful, like the video, share it with your friends, and subscribe to the channel Nursing Simplified for more nursing lectures. We'll meet in the next session, the next topic, vital statistics. Thank you.